HHA Practice Test 2026 Home Health Aide, Full Course Communicating with Clients' Families Part 2. Question 1. Which of the following is a barrier to communication? Eye contact. Background noise, TV/radio. Nodding. Summarizing. Environmental distractions can prevent clear hearing and focus. Question 2. The term objective in communication refers to personal feelings, measurable facts, opinions, guesses. Objective communication is based on what is seen, heard, or measured. Question 3. How should an HHA communicate with a client who has aphasia? Give up. Use communication boards or simple yes/no questions. Speak very loudly. Speak for them all the time. Tools and simplified options help those with speech loss communicate. Question 4. What is the primary goal of communication between an HHA and the client's family? To become best friends. To share information relevant to the client's well-being. To find out family secrets. To get tips. The focus is the client's care and safety. Question 5. When a client is blind, the HHA should sneak up on them. Identify themselves when entering and describe what they are doing. Move all the furniture without telling them. Speak in sign language. Verbal cues are essential for clients with visual impairments. Question 6. If a family member is providing care that contradicts the care plan, the HHA should tell them they are stupid. Politely inform the supervisor. Join in. Ignore it. The HHA must follow the care plan and report discrepancies to the agency. Question 7. Touch can be a powerful form of communication, but the HHA must always use it. Be aware of the client's comfort level and cultural norms. Never use it. Only touch the client's hair. Consent and boundaries are important for physical contact. Question 8. When writing in a client's chart, the HHA should use pencil. Use black or blue ink and sign every entry. Use whiteout for mistakes. Write only on Fridays. Legal records require permanent ink and authentication. Question 9. Which of the following is subjective information? A temperature of 99 degrees. A client saying I have a sharp pain in my hip. A skin rash. The client's weight. Subjective info is provided by the client's own perception. Question 10. Effective conflict resolution with a coworker involves talking behind their back, speaking directly and professionally about the issue, refusing to work, physical fighting. Professionalism requires direct and mature handling of issues. Question 11. The receiver in the communication model is the person who starts the conversation, interprets the message, ignores the message, throws the message away. The receiver is the destination of the message. Question 12. Good communication with a client who has dementia includes using long stories, breaking tasks into one-step instructions, quizzing them on names, using sarcasm. Simplified instructions reduce frustration. Question 13. A feedback loop in communication ensures the message was understood as intended. The person is listening. The person is happy. The noise is gone. Feedback confirms the communication cycle was successful. Question 14. When an HHA is feeling overwhelmed, they should communicate this to the client, the supervisor, the client's children, the neighbors. The supervisor can offer support or adjust the workload. Question 15. Why is silence sometimes a good communication tool? It's not. It gives the client time to think and respond. It's easier than talking. It makes people nervous. Pausing allows the client to process information and form a response. Question 16. To be culturally competent, an HHA should generalize about all people from one country. Respect individual differences within cultures. Assume everyone is the same. Avoid people from other cultures. Competency involves recognizing the individual within their culture. Question 17. In an emergency, communication should be long and detailed, clear, concise, and immediate. Sent via mail. Avoided. Time is of the essence in emergencies. Question 18. A client is crying. The best response is, stop that right now. Would you like to talk about what's upsetting you? You're acting like a baby. I'm leaving if you don't stop. Compassion and open communication are therapeutic. Question 19. Which of these is a professional way to end a shift? Running out the door. Checking that the client is comfortable and saying goodbye. Leaving without a word. Telling the client all your problems. Professionalism includes a respectful closure to the workday. Question 20. Communication is 7% words, 38% tone, and 55% body language. This means words don't matter. How you say something and your posture are very important. You should only use body language. Tone is the only thing that matters. Nonverbal cues often carry more weight than the actual words spoken.